why are people getting affected with this black fungus, and what are the symptoms that they can look out for?
Yes. So, as I was telling you before, black fungus or mucormycosis is an infection that is seen in an immunocompromised individual. When I say immunocompromised, that means that the body defense mechanism, the innate immunity of the body is down, and that is when the fungal elements invade into the tissues. So in the West, immunocompromised states would mean transplant patients, patients with hematological malignancies, extreme ages, what I mean is a very young age and very old age, and some of these factors play a role in making the patient susceptible to infection. But in an Indian context, in an Indian milieu, as you know, India is the diabetes capital of the world, and we see a lot of diabetics. And to add to that, we have the COVID situation now. So we have a huge COVID wave hitting us, and devastating, I would say, the country at this point of time. And that added to the fact that there are a lot of diabetic patients out there who are now COVID positive and recovering from COVID positive, or those who have recovered from COVID disease. These are the people who are now susceptible for mucormycosis, because when a person has diabetes, that means that the person has high blood sugar levels. And in a COVID infection, and especially if it's quite a deep infection, we would be giving steroids to some of these patients. Steroids again make the blood sugar levels go up, so that adds to the problem. So we are in a state of the patient is in a state where there is acidosis or increased acid levels in the blood due to high diabetes, and an increased level of acid in the blood predisposes the patient to fungal infections. There is also another theory that says that acidosis or increased acid levels in the blood leads to decoupling of iron from the chelating agents, and iron becomes freely available in the serum of the patient, and iron is very important in the growth and propagation of fungus. Fungus uses iron for its growth. So that is how the patient becomes susceptible to an infection as rare as this. So and once the organism makes its way into the body, it then tends to invade the blood vessels. That's why mucormycosis or black fungus is deemed as a angio-invasive fungus. So the moment it invades the blood vessel, it causes a thrombotic phenomenon, by which I mean that it creates a clot-like thing inside the blood vessel, and then that leads to ischemia or death of the part of the body that is supplied by this. So then you have a dead part of tissue, which then becomes necrotic, which means it gets decayed, and then that is where the fungus thrives, apart from the point of source of infection. Mucormycosis is a rather dangerous and although a rare fungal infection, not so rare now in this context, but it's a dangerous infection because despite effective treatment, the mortality rate of this particular disease is anything between 50 and 80%. So that's a very high mortality rate for any disease, and that's the reason why we have to be very careful about not to contract this disease. So the clinical symptoms most often revolve around the nose, and that's the reason why in this particular I would say epidemic of mucormycosis, we have seen the rhino-oculocerebral mucormycosis as the most common form of infection. There are other less common forms of mucormycosis, that is pulmonary, cutaneous, gastrointestinal, and other disseminated forms of mucormycosis. But what we are seeing today predominantly is what we call ROCM, that's rhino-orbitocerebral mucormycosis. Now what happens here is the organism enters into the nose and causes symptoms similar to sinusitis. Now that's what is the problem, because most people either treat themselves with antibiotics or medicines relating to sinusitis, assuming it to be sinusitis, while the problem could be deeper. And when the infection has actually established itself, or by invading into the deeper tissues and causing an ischemic necrosis, and by then it's a little advanced, and it would be difficult to treat some of these patients. So the patients have to look for black eschars, or black discoloration on the mucosa of the oral cavity, around the nose, around the eyes, on the skin, any part in the upper airway, I would say. That's one of the symptoms that one should look for. And I've been a part of the COVID advisory task force, and a part of the Mucor cell as well. And one of the things that we have been discussing is to give an advisory to the patients, to the people out there, that if you are COVID positive, and if you are a diabetic, and if you have had sinusitis like symptoms like nasal obstruction, congestion, even bleeding from the nose, headaches, intractable facial pain, you should immediately see an ENT surgeon and hopefully get an endoscopy done. So because COVID along with diabetes are very serious risk factors for the development of mucormycosis. Now, spread from the nose is always to the eyes. So, and this spread happens fairly quickly. So it can take less than 2 days for the fungal infection to enter into the eyes, the orbit, and just about the same amount of time for it to then move to the brain. Once it invades the brain, we call it cerebral mucormycosis. There's very little that can be done, and at this point it turns fatal for the patient. So there could be other clinical symptoms like fever and respiratory symptoms, which are rarer, but it's always the nose and the eyes which are affected, and it is symptoms around these areas that one has to be aware of.